Today, we are shining the Survivor Spotlight on Barb and Keith. Barb is a cancer patient at Aultman Cancer Center.
We've been on this cancer journey together for 22 years. 24 years. That's coming from the caregiver who worries so much. We've had 3 bouts of cancer.
It is a journey for both of us. If you've got the chance for great treatment, great doctors, use it. Depend on your doctors, depend on the caseworkers. They'll help you through the tough times and guide you and get you through it.
Our first diagnosis, the doctor told us we have as good, if not the best, technology and care that you will find in Northeast Ohio or the world right here in Canton, Ohio. Calmed us down. I've kept a positive attitude. I think that helped in the healing.
I'm sure it did.
Moving forward. And if you get down, there's all kinds of resources through the hospital, through their support systems. Use those resources. They'll help you navigate through this journey.
To support Barb and others in their local fight against cancer, make your donation at aultman.org/survivor spotlight.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
Live from the WHBC Broadcast Center. Find out more about area businesses, agencies, and events.
It's what's going on right now.
This is Spotlight.
Good Wednesday morning, everyone, and welcome to Spotlight. I'm Pam Cook, and of course, you are listening on the radio, but don't forget, you can always watch our WHBC video stream on our Facebook page at 1480 WHBC and also on our YouTube channel. Just go to YouTube and search 1480 WHBC and you will find it. And, you know, throughout the month of June, which happens to be Cancer Survivor Month, we have had a chance to talk to so many wonderful people from Aultman Hospital and the great care they offer for cancer treatment. And we've spoken with patients and administrators and those connected to the new cancer center and volunteers. And today we're going to speak with 3 doctors who are right there on the front lines. We have Dr. Raza Khan, who is a hematologist oncologist at Aultman Cancer Center. Good morning.
Good morning. Good morning.
We also have Dr. Jeffrey Marsh, who is the medical director for Aultman Hospice and Palliative Care. Good morning, sir.
Good morning, Pam.
And also Dr. Sareena Singh, who provides care at Aultman Gynecologic Oncology. Good morning.
Good morning.
We'll talk to Dr. Khan first. Let's start with you. Maybe you can just make our listeners familiar with you a little bit. Tell us a little bit about yourself and how you got to the place you're at right now.
It did raise some eyebrows when I came to this place and where I came from. I moved from Ann Arbor, Michigan, straight to Canton, Ohio. So I trained, I did my fellowship there in Ann Arbor for 3 years at University of Michigan. And then I worked there for 5 years before I decided to move. So there was a fellow oncologist here, Dr. Paul Manusak, who was trained in the same program. So it was very comforting for me to find another oncologist who trained in the same program. And then this place had a lot of other things which attracted me, including ability to do clinical research. We had Dr. Terry Mamonis here. He was a very well-known, established breast cancer researcher who happened to be our medical director at that time. So that was another reason I was attracted to this place. So it's been about 19 years now. I haven't looked back. So that label of coming from Ann Arbor, Michigan to Canton, Ohio doesn't hold as strongly now. So I'm more of a native Canton person now.
Are you wearing blue or red? That's the question.
Yeah, well, I deep down, I think it's still maize and blue.
I gotcha. So I see why you chose Aultman and understand that. Why did you choose the specialty? Why did you choose that specialty?
When we were looking into various things and rotating and finding out what was the hardest for the patients, we had plenty of capable surgeons, plenty of good quality physicians. And we're talking about 35 years back. Medical oncology was still an evolving field. Like as a field, it may have existed for not more than even 10 years. So there was a stark deficiency of qualified medical oncologists, and we needed more people to step up and fill that field. And the second part which attracted me was the chance of making a difference with all the research opportunities available for a disease for which little was known, and even worse, less could be done at that time. So we have studied the disease over the last 30, 40 years in many, many, many details. We have come up with various treatments. The life expectancy has increased. The chances of detecting the cancer in its early form has increased. The hope has increased. So it has paid well for those number of years that everybody has worked to get us where we are at. There's obviously a lot that still needs to be done. So it was those two things. One, there was a clear deficiency of those people who knew how to treat cancer. And second was the vast outlook of more research opportunities available in this field.
All right, let's bring in Dr. Jeffrey Marsh, Medical Director for Aultman Hospice and Palliative Care. And Dr. Marsh, maybe tell us a little bit about yourself and how you got into this part of medicine.
Sure. I'm actually a local. I went to Jackson and went to med school at Northeast Ohio Medical. And I really knew I wanted to be a doctor from a very, very early age. I mean, it was probably in middle school sort of where I was initially drawn that direction. So I went to the 6-year program at NeoMed, and that led to initially my career as an internist, and then I went into pulmonary critical care medicine because I really enjoyed dealing with high technology, and I enjoyed dealing with very, very sick patients. And I did that for about 18 years. But then the specialty of hospice and palliative care kind of found me, kind of drew me in, because I was really very interested in helping people that were seriously ill and trying to help them through really the most difficult part of the journey. And when an opportunity became available, because I had practiced pulmonary critical care in upstate New York and in Pennsylvania, I came back home because my own father was dying of cancer. And I got drawn into an opportunity to come back to Aultman. I'd actually done my medical clerkships in med school here at Aultman. But I found that providing this kind of care was both really spoke to me because it was about really making a connection with patients and really trying to offer whatever evidence-based treatments that were available to help to manage discomfort when we're dealing with a very difficult time, and really trying to help them through the process emotionally as well.
Yeah, I mean, this is a time you're talking about end of life care, correct?
Sometimes.
Sometimes.
That's something we can certainly talk about, the difference between hospice and palliative care. I mean, hospice, I think most people have been touched by hospice in their lives. And they know that's when there really are no good options for further treatment or cure. And we want to make sure that the time that's left is as high quality as possible. Palliative care kind of takes that, but doesn't necessarily imply that we're at end of life. All of these problems, whether they be cancer or whatever else that we might deal with in palliative care, there can be a lot of discomfort, a lot of stress, a lot of pain that's part of getting through that process. And that's what I do. I help to manage those symptoms so that we can proceed with the treatment that is the most beneficial, and to make that done under the patient's terms.
All right, and Dr. Sareena Singh. Dr. Singh provides care at Aultman Gynecologic Oncology. Dr. Singh, maybe tell us a little bit about yourself and explain what your job entails.
Sure. So I basically have spent my whole life in Ohio in various cities, Columbus and Cincinnati, and I did my fellowship at Case Western in Cleveland. So what a gynecologic oncologist specializes in is women's cancers, specifically in the female pelvis. So dealing with pre-cancer and cancerous lesions of the uterus, the cervix, the fallopian tubes, ovaries, and it's a combination specialty of both surgical oncology and also the chemotherapy aspect of medical oncology. So providing comprehensive care for women that have these disorders. So what brought me to Canton is, I've lived in Ohio pretty much my whole life. I love living in Ohio. I was previously living in Cleveland. And I knew that there was a very distinguished G1 oncologist here, Dr. Mike Hopkins, a pioneer in our field, and he was looking to bring somebody on. And I came down here and checked out the program, and really what was going on down here was really amazing. Taking very good care of our community, involved with community outreach, a lot of research. Just basically, this place was a hidden gem, and I knew it was going to be an opportunity to help the program grow. Additionally, Canton is a fairly large city, but when it comes to GYN oncology providers, with our unique specialty, there's only about 1,000 practicing G1 oncologists in the entire United States. So there was a major need for somebody to come down here and help take care of women that have these precancers and cancers, and provide the services closer to home rather than everybody kind of being shipped out to either Cleveland or Columbus or Pittsburgh.
And yours is a pretty specific specialty. Is there any reason why you chose that?
Oh, yes. Well, my training started in my residency in general obstetrics and gynecology, and I knew that I always wanted to work in women's health. And what drove me to that is, with OBGYN providers, really establishing a lifelong relationship with your patients. But with G1 oncology, I think it kind of put together my two interests in the perfect way. I love being a surgeon and the technical aspects of that, and then also the high-level medicine that comes with administering chemotherapy and taking care of patients with my colleagues like Dr. Marsh at the end of life, patients that are very sick. So it was the perfect blend of both of my interests.
All right, we now got a feel for how they got here. We're going to take a commercial break, and then we'll talk a little bit more about what they do while they're here, because boy, it's pretty amazing. And we will return with Spotlight right here on 1480 WHBC.
Love the show. Thank God for radio. I don't know where we'd be without it.
Oh, yeah, listen to you daily. Your station is so informative.
News Talk 1480 WHBC.
Anyone mind if I turn on the news?
We know WHBC has listeners all around the country.
No way! We are your ideal fans.
Now you can wear your Canton, Ohio colors wherever you live.
Can you explain this to me?
Go to WHBC.com. It says fan gear.
Look what I found.
You can order great Canton stuff with our WHBC logo.
And I love it.
Fan gear.
No way! That's amazing!
And let everyone know where your heart is.
Go to WHBC.com to find fan gear.
From home decoration to home improvement, get everything you need at a fraction of the price. At Habitat Restore in Canton, you'll find new and gently used furniture, appliances, home decor, building materials, and much more. In-store and online at restoreeco.org. And when you shop and donate at Restore, you'll help local families build homes with Habitat for Humanity. Habitat for Humanity Restore, the store that builds homes.
This is Mike Frazier, Senior Pastor at Canton Baptist Temple. I would like to personally invite you to worship with us at either 8 o'clock or 10:15 this Sunday morning in our worship center located at 515 Whipple Avenue in Canton, Ohio. If you cannot be with us in person, please tune in to our broadcast right here on WHBC at 8:30 on Sunday mornings. For more information about our ministries, you can visit us at cantonbaptist.org. We look forward to meeting you soon.
Hi, this is Joe Cordell with the law firm Cordell & Cordell. When the prospect of divorce becomes a reality, you need a partner that you can count on. If you're a man in this situation, consider contacting Cordell & Cordell. We've helped men navigate complex legal matters for 30 years.
Contact Cordell & Cordell to schedule an appointment with one of our firm's Cleveland area attorneys, a partner men can count on. Online at CordellCordell.com. 5005 Rockside Road, Suite 350, Independence, Ohio 44131.
If you're tired of the old cable news, you now have a choice. It's Newsmax. Every minute, Newsmax gives you the real news you can trust. Watch people like Ben Carson, Mike Huckabee, Alan Dershowitz, Dick Morris, Nancy Brinker, Mike Reagan, Rudy Giuliani, and more. Newsmax is on all major cable systems or free on Roku, Zumo, Pluto, YouTube, and most smart TVs. Plus, download the free Newsmax app on your smartphone and start watching Newsmax now, America's trusted news source.
At Paclay, they pride themselves on serving families in Massillon and the surrounding areas with dignity, respect, and compassion. The families they serve are their top priority and have set measures in place to help protect and accommodate the elderly, sick, and members of the public, and will make every effort to accommodate families in making arrangements, conducting services in any capacity needed to ensure their safety and comfort while honoring their loved one. Paclay, serving the community with grace and compassion.
Tom Bodette here, still leaving the light on for the long-haul trucker. While we were locked down at home, you were out there day and night bringing us what we needed to make it through. And Motel 6 is here to help you make it through. Want to trade a loose load strap and a sore back for a good night's sleep? Yes, you do. Motel 6 has a place just down the road with a clean, comfortable room and a great low rate. You'll know it when you see it. I'm Tom Bodette from Motel 6, and we'll leave the light on for you.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
Now back to Spotlight on 1480 WHBC.
And welcome back to Spotlight on 1480 WHBC and Cancer Survivor Month. We're wrapping it up by talking to 3 doctors from Aultman Hospital, and we're going to find out now a little bit more about their days and what their practice includes. And we're going to go back to Dr. Singh right now. And Dr. Singh, I want to ask you to kind of explain maybe what your day entails. What's an average day for you like? I'm sure there isn't anything typical about it, right?
Nothing typical, a lot of surprises, very busy, but very fulfilling. So I mentioned before, I do a combination of surgical procedures for cancer patients and then also offer chemotherapy treatments. So I have to kind of split up my days based on those 2 components of my job. So on Monday and Tuesday, I'm in the operating room from pretty much 7 a.m. in the morning to almost 7 p.m. At night, operating on patients and also rounding on my patients that are admitted to the hospital. And then the rest of the week, Wednesday and Thursday, are my office days, and those are also the days that I'm giving patients chemotherapy. So those days also start in the morning, make rounds on inpatients, then I visit the infusion center in the main hospital, and make sure that my patients are all tucked in to get their chemotherapy treatments, and then I spend the rest of the day in the office seeing about 30 or 40 patients. So always on the run, always on the go.
Yeah, I was going to say, I don't know if you could say how many patients you have at any one time.
Oh, I have no idea.
No idea.
I'm not sure I want to know the number.
You just keep going and going, right?
Exactly.
Anything surprising? Anything that you think our listeners would find surprising about your practice?
Well, I think, again, the uniqueness of me doing the surgical care and the chemotherapy administration and immunotherapy treatments, that's very unique to our specialty. For most of the other cancer sites, you are kind of seeing a surgeon for one aspect of the care, and then your medical oncologist for another aspect of the care. So just being able to, provide that comprehensive care for patients that have these female pelvic malignancies, I think is very unique and something that I'm very proud of.
Let's bring Dr. Marsh back. I want Dr. Marsh to talk to us a little bit about where his practice is. Dr. Marsh, where is it located? And talk a little bit about the team that you work with, because I know that's important to you as well.
Sure. My practice is in the hospital, it's in the office, but it's actually in the whole community at large, because we have a multi-pronged palliative care program that includes both the clinic, the supportive oncology clinic, which is part of the cancer center, but we also see a large number of patients in the hospital who have serious illness, who have issues related to symptom management and goals of care. But our palliative and hospice home programs that are run out of the Woodlawn campus is really quite extensive. And that includes a lot more than just me. And I've got 2 other board certified partners. I've got 8 nurse practitioners, a large number of nurses, aides, and chaplains, and a music therapist and massage therapist. They're all part of that team. My specific role is working in the cancer center, and that's where most mornings I'm here through the whole morning and seeing patients that are referred from our oncologists who need help with complex symptom management. I mean, unfortunately, cancer, even very treatable cancers, sometimes come with a lot of discomfort, pain often, sometimes nausea, sometimes shortness of breath, sometimes just even sleeplessness or anxiety. And those require a really very tailored attention to be able to do the best symptom management. So that's what I spend a lot of my time doing. But as well, then after I'm done with my office, I'm usually up in the hospital wards seeing patients there as well.
And I know we have to take a commercial break here real fast. And Dr. Khan, I don't want you to think we forgot about you, because we didn't. And when we come back, we'll talk to Dr. Khan about what his day is like. We'll also talk a little bit more about some of the things that, I don't know if we call them, let's call them misconceptions or things that people perceive about cancer treatment. And maybe Dr. Marsh, Dr. Khan, and Dr. Singh can kind of straighten that out for us and explain to us a little bit more about that. We'll talk about the new cancer center as well. Again, that's all coming up on Spotlight here on 1480 WHBC.
There's so much texting going on. Hey, get your phone out and put our new text number in it. Anytime you want to text us, you can.
Pam Cook, Jim Michaels, J.D. DeAngelis, John Bozica, Ryan Novak, Kenny, and J.T.
330-583-4591.
Today, we are shining the Survivor Spotlight on Barb and Keith. Barb is a cancer patient at Aultman Cancer Center.
We've been on this cancer journey together for 22 years. 24 years. That's coming from the caregiver who worries so much. We've had 3 bouts of cancer.
It is a journey for both of us. If you've got the chance for great treatment, great doctors, use it. Depend on your doctors, depend on the caseworkers. They'll help you through the tough times and guide you and get you through it.
The first diagnosis, the doctor told us we have as good, if not the best, technology and care that you will find in Northeast Ohio or the world right here in Canton, Ohio. Calmed us down. I kept a positive attitude. I think that helped in the healing.
I'm sure it did.
And moving forward. And if you get down, there's all kinds of resources through the hospital, through their support systems. Use those resources. They'll help you navigate through this journey.
To support Barb and others in their local fight against cancer, make your donation at aultman.org/Survivor Spotlight.
Don't miss Dan and Shay headlining the Highway 77 Music Festival, plus Dustin Lynch and many more Sunday, September 12th at Tom Benson Hall of Fame Stadium in Canton. Get your tickets now at hallofamevillage.com.
Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Hello, this is Mark Koontz. Want to strike out your pain? Then Green Compassion Network can help you. See if you qualify for medical cannabis by visiting gcnhope.com or stop by their new location at 1201 South Main Street in North Canton, where you can purchase Proline clinic-only CBD even without a medical card. Call 833-GCN-HOPE or visit gcnhope.com.
If you're thinking of buying a water softener, make Verndale's Water Center your first stop, and a free reverse osmosis drinking water system is included. Take advantage of 0% financing for 1 year. For clean, clear, great-tasting water, call Verndale's Water Center today.
Verndale's Water Center.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Ohio remains in the middle of the pack when it comes to dosing out vaccines to its residents. More than 47% of Ohioans have received at least one dose, and more than 44% are fully vaccinated. About 10 states are below 37%. General Motors recalling more than 380,000 older SUVs, many for a second time, to fix a suspension problem that can cause them to sway at high speeds. The recall covers the 2010 through 2016 Cadillac SRX and certain 2011 and 2012 Saab SUVs. The average cost of a house in the United States rose by 14.6% in April, marking a record-setting increase. The price hike makes the average cost of a house almost 35% more than it was in 2006. That was considered a peak year for housing prices. The rebranding of Aunt Jemima is nearly complete, with Pearl Milling Company syrup and pancake mixes starting to appear on store shelves. The company announced earlier this year that it would retire the Aunt Jemima brand due to its origins as a racial stereotype. After 6 days of digging through the rubble left by that collapse of Florida Champlain Towers South condo building, emergency crews have found 2 more bodies. Tuesday's discovery of the bodies brings the official death toll to 12, although 149 more residents remain unaccounted for. They've been working nonstop for 6 days at a slow and methodical process. More news coming up at 10 o'clock. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Mostly cloudy skies continuing for the rest of the day with a couple of showers and a thunderstorm. High this afternoon, 81. Warm and humid tonight with periods of rain and a thunderstorm and a low of 71. Then rain and a thunderstorm from this evening will continue through tomorrow afternoon and can lead to flooding. High on Thursday, 76. Friday, we'll have a mix of clouds, sunshine, and a high of 74. I'm Holly Holdren for News Talk 1480 WHBC.
The time is coming for you to once again be a hero to families in your community. The 14th annual AultCare Wishathon supporting Wishes Can Happen returns August 12th and 13th at Springbrook Plaza, presented by Mix 94.1 and News Talk 1480 WHBC.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
Now back to Spotlight on 1480 WHBC.
And welcome back to Spotlight, everyone. I'm Pam Cook with you on this Wednesday morning. Don't forget, you can check us out live on our video stream as well at Facebook at 1480 WHBC. Also on our YouTube channel at News Talk 1480 WHBC. Cancer Survivor Month, that's the month of June, and we have been spotlighting Aultman Hospital and their wonderful care that they offer for cancer treatment. Today, we've been talking with Dr. Raza Khan, also Dr. Jeffrey Marsh, and Dr. Sareena Singh. And we're going to go back to Dr. Khan because we didn't get a chance to ask him about his typical day. And I know that really, much like the business I'm in, the business you guys are in, there really is no typical day. But talk a little bit about what it's like for your practice and where your practice is located.
So we are located right in the hospital. So we are at the main floor of the hospital, where those who are familiar with Aultman Hospital, with the pharmacy and the gift shop, there's a long hallway that leads to that place where it says Cancer Center. So we're on the main floor of the main hospital. So that's where our offices are. Our infusions happen just 2 floors above us on the 3rd floor. And I think you asked about the day. How does the day shape out? It's usually a long day. We start anywhere between 7 to 8 with some sort of a meeting in the morning. It could be a tumor board where other colleagues are present to discuss patients' cancer-related problems. We have radiology look at the images, pathologists who give us the detail about the diagnosis. Then the surgeons, the radiation oncologist, and the medical oncologist, they come up with a coordinated, comprehensive plan how to treat those patients. So 2 or 3 days a week, we may have a tumor board. Then the other meetings, those are more to do with the organizational part of the program. I hold some additional responsibilities. We are participating in American College of Surgeons Commission on Cancer, which gauges how well the programs are doing. So there is a commission on cancer committee that functions in the hospital. So I've been the chair for that committee for quite a few years. So we have to look through our own processes to make sure we are performing at least as well as other institutions of our size in our area and nationwide. So we gauge ourselves. Are we doing worse? Are we doing as good? Or are we doing even better? So that's one thing how we gauge and make sure we follow the processes. The second is more of our internal organization, and we have this Cancer Center of Excellence. So I happen to be the medical director for that and president for the board for this organization. So that coordinates all the involved people to make sure we achieve those goals where our patients, it could be clinical research, getting some cutting edge therapy, starting some new device, state of the art radiation oncology, to make sure we get all those things available for our patients. So it's some of it is organizational. Then usually between 8 to 9 we see our first patients. We have a lot of support available. It's not just me. I may be seeing 20 to 30, sometimes even more patients a day. That's a lot of patients for a specialty, and especially medical oncology and hematology. So we have our scribes who can scribe the note while I'm talking to the patient, not taking my attention away from the patient. Then we have the front desk staff who's getting all the information from the patient being checked into the room. After the patient leaves, we have a very special group of nurses who are the care coordinators. So they will make sure all the lab parameters were looked before the patient goes get their treatment. They will plan the day, how the patient's day is going to pan out, what would they do the next day, how the next week, 2 weeks or 3 weeks will shape out till they come back. In between, patients are very used to, very comfortable talking to them. They will call them about the progress, any hindrances, any side effects they're having from the treatment, to have those care coordinators available. Then there is activity going on between different departments. So then we have the nurse navigators who may coordinate their care between the surgery, radiation, medical oncology, the diagnostic part. Then, of course, there are financial counselors. We have nutritional support people. So there's a whole team. That's the surprising part. Patient may just know my face, but they may not realize how many people are trying to coordinate their care to make it smooth and as less interrupted as possible. So day goes on, and then we have to see inpatients. So we have sickest of the patients get admitted in the hospital. So you may see them. Sometimes you have time in supposedly a lunch break, which actually never pans out, but you see them at the end of the day. So the day doesn't end till you really finish your day. But we're there to make sure every day finishes, and we do everything on that date so we can start a new day the next day. So it's a long day, but that's how it is. That's what it takes, and that's how it happens.
Yeah, if there's one thing that I have learned over this past month of June, and everyone that I've spoken to, is that it does take quite a few people. It's an enormous venture treating the folks, the cancer patients at Aultman. But what would you say that there's a common cancer that you treat, or what are the most common cancers that you treat?
What I treat, I have a research interest and the clinical interest in lung cancer. And the next commonest cancers that I treat are the genitourinary, the prostate, the bladder cancers, testicular cancer. Then we are 4 in our practice. We are 4 medical oncologists. So we don't have the luxury of just restricting ourselves to what our area of interest is. If you have 20, 30 medical oncologists in a bigger organization, they usually dedicate themselves to one particular cancer type. The commonest being lung cancer, colon, prostate, breast cancer. Those are the 4 commonest. So a lot of institutions have even 1 or more who are just dedicated to see that type. We end up seeing others too. I, for instance, may see lymphomas, myelomas, which are hematologic malignancies, or colon cancer or pancreatic cancer. But the major bulk of my patients would be lung cancer and the genitourinary cancers. That's what I treat.
All right, let's bring Dr. Jeffrey Marsh back in, because I know we kind of touched on this just a little bit about explaining hospice care and explaining palliative care, but let's talk about it a little bit more, because I think people don't many times don't understand what it is.
Actually, many doctors don't really understand what the difference is. Palliative care is really a broad umbrella, and it basically implies that for people with serious illness, you need to pay attention to the symptoms and the emotional distress that come along with that illness to give people the best chance of a successful outcome. So when we deal with palliative care, it's not necessarily with a terminal problem, it's one with a serious one. Hospice is a very specific group of those patients that have a terminal illness, which we define as being life expectancy is less than 6 months. When there is no longer desire for aggressive treatment and hospitalizations and tests and poking and prodding, it's about trying to be at home and make the best of the time someone might have. Palliative care, in the broadest sense and what we try to provide, does not take away any options for any treatment. It simply understands that being seriously ill can be there can be suffering along with that, and we have a lot of tools available to minimize that suffering. But that if patients wish to pursue the most aggressive chemotherapy, if they wish to have a bone marrow transplant, or if for non-cancer diseases, if they wish to have any other very aggressive type stuff, palliative care can have a role in helping to mitigate the suffering that may be part of that. So that's kind of the way I would usually describe it.
And is it just for the patient, or is it for their family as well?
It's all comers. The caregivers, which we rely upon for both, for all kinds of patients, have to learn a lot to be able to help manage symptoms. They have to. They're under their own emotional strain, trying to adjust to the changing roles that they might have. They're very key parts of being able to help manage and improve someone's quality of life.
And Dr. Singh, I wanted to ask you real quick before we have to take a break, just for your types of cancer that you treat, which is women's cancer, are there resources or places that people can go to get help or questions answered that you would recommend?
Sure. I mean, my office has a very similar setup to Dr. Khan and Dr. Marsh's office. So we have people that work in my office who are good resources. I have a care coordinator, just like Dr. Khan does. I have a nurse practitioner. There are a lot of just generalized good websites to go to. The society that most gynecologic oncologists are members of is called the Society of Gynecologic Oncology. They have a lot of good patient information and resources. That would be at SGO. .org, I think, and then also more general information about the types of cancers that I treat and what everybody else treats as well can be found on the American Society of Clinical Oncologists, and then specifically maybe more for women's health related issues, there's the American Congress of Obstetrics and Gynecology. That's kind of the main organization that is overseeing obstetrics and gynecology providers and plus subspecialists like me.
All right, we are going to take a quick break. And when we come back, we're going to talk a little bit more about this wonderful cancer center that's being built. If you have driven over to Aultman Hospital, you see the construction work. The Timken Family Cancer Center. We'll discuss that coming up on Spotlight on 1480 WHBC.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
You can follow us on Facebook, Twitter, and Instagram on your smart speaker, tablet, or phone, too. Just download the iHeart, Odyssey, or radio.com app. Be sure to check out our website daily for the latest at WHBC.com.
Save today on your next project with 11% off everything now at Menards. Dutch Boy Max Bond is an exterior paint and primer with extreme adhesion technology. It provides superior adhesion to chalky, dirty, glossy, or previously painted surfaces. Save today on your next project with 11% off all Dutch Boy Max Bond exterior paint. Good through July 4th. Savings are a mail-in rebate. Some exclusions apply. See store for details.
Save big money at Menards.
Do you hear My Computer Career ads and think, I don't know anything about computers? Well, you don't have to. Before starting, many graduates could turn a computer on and off. And that's it. Now they're IT pros. You could do it too. Go to mycomputercareer.edu and take the free career evaluation. You could start your new life in as little as 4 months. Grants covering up to 53% of the cost are available to those who qualify. It's not rocket science. It's My Computer Career.
Everything's opening up. People are getting out more. It's time for you to feel better and look better. Hi, this is Pam Cook. Join Mark Patrick seminars and lose weight or stop smoking guaranteed for only $49.99. The seminars are July 12th at the Holiday Inn in Canton. Registration starts at 5 o'clock. It worked for me. I quit smoking through Mark Patrick seminars 5 years ago, and I feel great. It can work for you too. Again, that's July 12th at the Holiday Inn in Canton.
If your family depends on your income and something happened to you, what would happen to them? You need life insurance, and SelectQuote can help you get it at a price you can afford.
SelectQuote found Jacob, 40, who's in excellent health, a 10-year, $500,000 policy for only $19 a month.
Not in perfect health? Don't worry.
SelectQuote found Tanya, 40, who has type 2 diabetes, a 10-year, $500,000 policy for only $32 a month.
We shop companies like Protective, Prudential, American General, and others to find you the company with the best rates. Give your family the security they need at a price you can afford.
For your free quote, call 1-800-519-0449. That's 1-800-519-0449. Or go to selectquote.com. That's 1-800-519-0449.
SelectQuote. We shop, you save.
Get full details on the example policies at selectquote.com/commercials. Your premium could vary depending on your health, issuing company, and other factors. Not available in all states.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
And again, we are talking about Cancer Survivor Month. We are talking about Aultman Hospital. And of course, we are talking about Aultman's Timken Family Cancer Center, which is in the process of being built. If you have been over to Aultman, you notice the construction work. It's happening right in front of our eyes and is going to be a fantastic place. And I want to ask each of you how you have felt about this. Let's bring in Dr. Marsh first. When you heard the news, Dr. Marsh, about the cancer center being built, what were your first thoughts?
I was super excited about it because, you know, the vision of this cancer center has been to be able to bring all our various parts, all our large extended team together so that we could be able to collaborate and coordinate care for any individual patient. I mean, we've got a fantastic staff that's been working in a facility that was state of the art about 30 years ago. But now our staff is going to be able to shine in a really beautiful new facility. But most importantly, my office is going to be right next to Dr. Khan's office, and Dr. Singh's office is going to be just down the hall, so that the surgeons, the medical oncologists, palliative care, and the radiation oncologists that we haven't talked about yet are all going to be part of the team, being able to talk in real time about how we're managing a particular patient situation.
Yeah, I mean, I think, and that's important to the patient too, is they don't feel like they're running around to a million different places. Dr. Singh, can you share with us a little bit about the Cancer Center, like what people can expect when they go there?
So I think it's just, the main thing is it's just going to be a very easy to navigate system. As Dr. Marsh and Dr. Khan mentioned before, right now everybody is scattered. You may have to see a surgeon in the physician's office building, a medical oncologist over in the main hospital. Radiology is in a different location. Go to one other part of the hospital for a procedure. It's just going to make things very easy. Everybody's going to be in the same building, and that's also going to I think make things a lot better for us physicians, having our colleagues just right down the hallway, curbside consults, discussing difficult cases. So really, we're just trying to make the system easier to navigate, both for the patients and the providers. And not to mention the fact that, with having everything in one building, some of our patients are very sick and it's difficult for them to get to different parts of the hospital. So having everything with regards to your cancer care focused in one spot can only lead to better outcomes.
I'd also, as we get closer to wrapping up here this morning, I'd also like to ask each of you if there's anything new in your field that you're excited about. I mean, anything coming along that you can think about that you would want to share. Dr. Khan, maybe we'll start with you. You can tell us a little bit about, anything that you're thinking of.
Yeah, certainly. It's a very exciting time of what is coming. And just allow me to add a little information for the viewers who are watching this. There is a flood of information on the internet when they go. Two sites I want them to pay attention to and get some useful information would be the National Cancer Institute. So that site is called nci.gov, G-O-V. So it's nci.gov. So it has very useful patient-friendly information on it. The second site is maintained by American Society of Clinical Oncology. So that is called cancer.org, cancer.org. So if you have any information that you need in a very basic format, please refer to those two. And then there are other credible places, Cleveland Clinic, Mayo Clinic, Memorial Sloan Kettering. Feel free to check those out as well. Coming back to what is exciting, just to give you an example, we used to have like maybe 3 or 4 drugs discovered during the whole year. So top-notch clinical research used to be published in New England Journal of Medicine. That is published every week. And for 3 or 4 drugs to remember in a year, that was easy for us. Now what is happening is that every week in those 4 or 5 original research publications that we see in New England Journal of Medicine, maybe 2 or 3 are oncology-related drugs. It has become even hard for us to remember the name of those drugs. With all this information obtained about Human Genome Project, the abnormal genes, how we compare it, and how efficiently and how quickly, just an example, how quickly a vaccine to COVID-19 came, it has given it like an unparalleled ability to come up with a new medicine with the problems we are facing with. And it's just amazing how many things are surfacing. Just to give you an example, there's a very exciting new therapy. It's called CAR T-cell therapy, or chimeric antigen receptor with T-cell manipulation. So T-cells, which are a type of lymphocytes, are taken out of patients' blood. Then a certain gene is introduced into that very T lymphocyte, which allows that T lymphocyte to now recognize a part of the tumor protein which we usually call an antigen or a receptor. And now the same lymphocyte, instead of just laying idle in the body, not doing its work, will recognize a cancer cell, attack it, and kill it. We're seeing long-term gratifying results with resistant lymphomas, for which patients it was usually a death sentence. I have one patient 5 years out, did not require any treatment, who would have been dead 4 years ago, living after getting this one dose of CAR T cell therapy. We're seeing very exciting results in multiple myeloma and so forth. So it's the hope is around. We're seeing new drugs every week and some new exciting different mechanisms other than the drugs which are becoming available for the patients.
That's awesome.
We've got a very robust clinical trial program in Aultman Hospital for all sorts of tumors. So patients are very welcome to inquire from us what can they do to participate in those trials.
I wish we had more time. I'd love to continue to talk to you. It's been a great month of June that we've spent talking about the wonderful care at Aultman Hospital. You guys are part of that, and I appreciate you coming on with us today, Cancer Survivor Month, and getting ready for Aultman's Timken Family Cancer Center. I know you guys are looking forward to that, and appreciate you coming on today. Thank you so much.
Thank you for having us.
Thank you.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
This time of year, Mother Nature can't make up her mind about what she's going to do. And that's not a good thing when you're trying to keep your car clean. Hi, I'm Pam Cook. If you're like me, you want to make sure it's taken care of all the time.